So certain patients who aren't ideal candidates for LASIK, we will recommend PRK, which is Photorefractive Keratectomy. That uses the same laser that we use for LASIK, we just do it without creating a flap. So you will make a wound on the eye that we can cover with a bandage contact lens, and it takes about 5 days for the tissue to regrow, and then the vision takes just a little bit longer to recover than a normal LASIK would, but it has the same successful end result. So ICLs benefit patients who have much more prescription and don't have a thick enough cornea to be able to do all of the treatment straight on the cornea. And so we can actually implant a lens that can correct your prescription without having to touch the cornea. So refractive lens exchange is a really good idea for patients who have early cataracts or who have too high of a prescription to be able to do LASIK or PRK. We do that as kind of an early cataract surgery where you remove the lens of the eye that would later develop into a cataract and go ahead and get a 2-for-1 surgery where you don't have to deal with cataract surgery in the future, and you can correct your prescription at the same time and be able to be glasses free. So the downtime for our refractive procedures is very little. We tend to do our LASIK and PRKs on a Friday because you can be back at work on Monday. The refractive lensectomies and ICLs just take 10 minutes or so in surgery and you're back seeing better the very next day. You just have a few restrictions on what you can lift and when you can bend for about a week, but otherwise you can go back to all your visual activities. PRK takes a little bit longer to recover from a vision standpoint, but a lot of people can still do their daily tasks. It's just not quite as sharp for a couple of weeks after surgery. So all of these procedures have an end result of being able to see very well and correct your vision, mostly without glasses. And so it's just us determining which one is the best choice for you with your eyes, your age, and what your corneas look like.